healthcare is a primary responsibility of government. Being able to provide good healthcare and at lowest cost possible, and with the latest available medicines and latest available technologies that can be adapted to usage at a mass scale. So challenges are many, and that's a solution that we are definitely working on, and we are trying to make it more and more effective. In fact, we already have many such initiatives that our government has implemented. We have our Tele ICU facilities that we have implemented. 2 centers, we already opened, one in Mysore and one in Hubli, and shortly we'll be opening one in Bangalore and Bellary, where our ICUs at the taluka level, remote areas, they cannot get the best of the doctors. So now the facility that we have set up in coordination with other NGOs and other people who have been interested in doing some good work in health sector. So in this joint collaboration, we are now able to, the ICUs in the taluka hospitals are being now manned by the district level hospitals where they have specialists, and they are in constant touch. They can see everything that's happening in the taluka hospitals with our cameras which are high resolutions. They can see the data, they can see the information, and they can analyze the patient there, whether he needs to come to the district or to a super specialty, or whether he can be treated there. So that's one component, Tele ICU. Then we got our brain health initiatives, where again using NIMHANS as the hub. We are now reaching out across the state. Then even for the, we've got another program that is being launched shortly, where cardiac arrests and severe heart attacks, if it happens in a village or in a rural area, the golden hour is, we all know about the golden hour, where if that person can be treated within 1 hour or within that hour, 2 hours, his chances of survival goes very high. So we have set up this facility where we provide them the ECG facility. That ECG is again read by an AI-assisted technology, which checks the ECG whether it's going to be a severe heart attack or not. And then again is looked by a doctor in Bangalore, a specialist. And in case of emergency medication needs to be given, we have provided that medication at the hospitals. So if that injections are given at that particular point of time, something they call it as tenecteplase and other medicines, that person survives. He overcomes that initial difficulty that he's facing, and then he can be taken for subsequent care. So this can save lives. So this kind of technology where you have remote, tele access, you have AI which is looking at all these things and helping us in identifying those people who may be having a severe heart attack, and then being able to diagnose and treat. So this is what is actually saving lives today. In fact, we are also doing something with the AstraZeneca, where all our digital X-rays that is being taken in all hospitals across Karnataka, that is AI screened, and for about 27 to 28 lung infections. And anyone which pops up for high probability of cancer or chest diseases or TB, using that is further screened, and then treatments are being given. So that is something that we're working with AstraZeneca as of now. Just a few months back, we did the MOU. So similarly, we want to work with all various companies.